Good morning, everybody. It's very nice to see you all here in person. I worked with Rob as the co-chair for the design team, and I think if he was here today, he'd be very pleased with the group and with the work that we've done so far. I also want to say a special thank you to David and Norm and the other leadership that supported us all the way through setting this up and getting the work started. As everybody has said, the work is not starting today. Obviously, a lot has gone into this already for the last year. So thank you to everybody who's been a part of this. So I'm going to take a couple of minutes today just to first of all talk to you about the research plan. Now, if you're in the room, you already know a lot about our research plan. So I'll just give a brief overview. And basically this will be covered in much more detail by Sanjeev and the rest of the HeartShare team. But if there are a few people who got pulled into this program at the last minute, the last couple of weeks, thank you for being here. Basically, there are two components to this. Basically, the first one is component one, collecting all of the existing data. So as you know, NHLBI has a lot of cohort data, trial data on HFpEF patients. We'd like to pull all that together. Some of those patients have existing biospecimens. They have raw data in terms of imaging. And so we'd like to pull all that data, create an imaging repository, and do multi-omics on that data, put it all together for advanced analytics so that we can use machine learning and AI. And the goal, as you know, is to find the subtypes within the HFpEF umbrella term. And really, once we find the subtypes, the goal is to figure out what are the biomarkers and what are the targets for each specific subtype of disease. The bottom half there is component two, which is to create a new cohort of HFpEF patients. And that we hope can be a long-term resource for clinical studies, for deep phenotyping, and in the future for clinical trials. And so I won't go into the details of everything we're doing, but that's the main bottom portion of the slide, is basically to create a new cohort, to figure out the subtypes, and then at the end of this, in 5 years, to get to a master protocol, similar to what oncology has been doing for years, to try to find targeted approaches to treat people depending on each specific subtype that they fit into. So the most common question that people have asked along the way is, what's the difference between HeartShare and the AMP? And just to go over it briefly, because I think some of you probably have a good sense of that now, but maybe not everybody does. So NHLBI released 2 RFAs about 2 years ago for a program called HeartShare, and HeartShare's components were the same 2 that I just showed you on the previous slide, to look at extant data sets, pull them together, and to create a new cohort of HFpEF patients. So on the left side there, those are the cohorts and trials, some of them, not all of them, obviously, that we would like to pull together under the HeartShare umbrella in blue. And then the blue icons there for sites. We have 6 clinical sites now for HeartShare, and those are the 2 components of the HeartShare program. Now, if you continue down the left side, let me see if I have a pointer. If you continue down, you'll see that, all of that data will be pulled together for harmonization and multi-omics analysis. But the data will reside within this cloud-based storage ecosystem called BioData Catalyst. And that's going to be a really important part of our program, of our data analysis and storage. I want to call out Shweta, who's part of the BioData Catalyst team. That's going to be a very important part of this whole endeavor. Now that's the HeartShare program, and it's meant to be a foundation for the AMP. So if you look on the right side, the industry trials that we think industry may want to contribute, that data can come in, and we'll put that in as part of our extant data set analysis. And then whether we decide as a group to fund 2 additional sites, 4, 6, whatever the number is, those sites will be part of a larger program so that the whole HeartShare program and the industry supported side will constitute the AMP program. So I hope that's clear. I thought a visual of this would be most helpful, but the data from both sides together will be within BioData Catalyst for a combined analysis. So one important part of our research plan is obviously patient recruitment, and diversity is a very important part of this. So we talk a lot about this within NHLBI. It's one of our core values. And I think especially for this disease, it's important to have a population that captures the heterogeneity of the disease itself. So the map on the left there is just a pictorial of the sites that we have and their geographic distribution, because as you know, depending on geographic location and many other factors. This isn't just East Coast disease or a West Coast, it's an international problem, and we need to address it in that way. On the right side, there is some of our projections from the 6 sites that we have in terms of what kind of patient population we potentially could enroll. So these are from the numbers that you gave us in your applications. We pooled them for the 6 sites. And you can see that our potential cohort could look like slightly more than half female, which fits the disease, and 42% diverse populations of Blacks, Hispanics, and Asians and mixed races. So this is a starting point. If we could collect more underrepresented groups and, expand on the diversity, I think that would actually go a long way towards understanding the disease. All right, so I'm going to change gears a little bit. I want to tell you just a couple things about current ongoing efforts, and then a couple of upcoming collaborations that are possible for this AMP program. Okay, so this slide is basically to tell you about some imaging efforts within BioData Catalyst. And so the top line there talks about the top half talks about component 1. You can see the multiple data types. And what I'm alluding to here is that we historically have used imaging information in all of our analyses, but we use the measurements. And if we can pull in the raw data from the echoes in DICOM, we can pull in the ECG waveform data, there's a lot of additional information there that we could analyze with AI. So the goal here is to create some infrastructure within BioData Catalyst to pull in the imaging data. And the core lab locations where all the data resides is all over the country, as you know. And so we're talking to a couple of different commercial solutions to help us with data ingestion, with de-identification, with processing of the data. A big part of this, as Shweta knows well, is how do we link all of that data that comes in terms of imaging with the existing clinical data, lab data, omics. That's a huge problem, even though it seems really obvious. But imaging data by itself really exists in the context of all the other data. So that's critical. And then how do we make that data accessible? Perhaps most importantly to all of our partners, how do we put that in a controlled access environment, but make it easy for partners to access? So 7 Bridges is part of the BioData Catalyst ecosystem, and these are some of the things that we're working on right now. Just one word about upcoming collaborations. So you saw at the beginning, many of the other AMPs have created large volumes of data, and there's a common metabolic diseases AMP, which addresses a number of different diseases together because they may have common underlying molecular mechanisms and drivers. And so that includes cardiovascular disease, obesity, type 2 diabetes, liver disease, kidney disease. So they're attacking everything, including heart failure and atherosclerotic disease. But the point here is that they've collected a lot of genetic data and some other omics data. And in the future, we're having some early discussions on how we could partner our data within BioData Catalyst, within the AMP heart failure, with the chronic metabolic diseases AMP. Finally, so there are 3 other efforts that we know of, and we've had some interaction with across the world. In Canada, CIHR, which is the NIH equivalent in Canada, they just funded a large heart failure network grant. I won't go into the details, but Sanjeev has been talking with them. We've been planning with them for a couple of years, actually, on how our 2 programs could collaborate, what a collaboration could look like. And then finally, in Germany, there's a program, Carlos, if you're here, I just met Carlos, a fellow from Charité Hospital in Berlin, and they have a very nice program that's more focused on animal models and basic science. And they do have some clinical work. They're doing hemodynamics and biopsies, so very complementary to HeartShare. So that's something where definitely, I know Carlos is working with Sanjeev already. So there's a really good possibility for interactions there. So those are all future collaborations. And at this point, I will stop. There we go. Thank you.